No. Good afternoon, ladies and gentlemen of the media. The Premier, the Honorable David Burt, JPMP, will give an update. Thank you.
Good afternoon, everybody. Welcome to my cabinet colleagues, community partners, and the Chief Medical Officer. I want to start this afternoon with a thank you. There are many people who are working around the clock to help put processes in place that make a difference to the lives of Bermudians during this unprecedented global pandemic. We have come together and we are all working together. Bermuda, with the rest of the world, is facing a new reality. We are operating together like never before. Our only references are hurricanes, where most of the time we know they are approaching and when they will hit. We check on family members, neighbors, and friends to make sure we all have the necessities in place. When the storm passes, we get up, dust off, and move forward together. COVID-19 is like nothing any of us has seen in our lifetime. The work and preparations we are putting in place will carry us forward for weeks or even months. I honestly cannot state when this COVID-19 era will be over. What I can say is that we must all do our part. If we listen to the health guidance that has been given, if we practice social distancing, and if we wash our hands and stay at home, we can flatten the curve and make sure that our health service and our hospital is not overwhelmed. We each have a part to play, and I truly appreciate the effort by everyone who is helping to make a difference. I will begin my update with results from the Ministry of Health. There are additional testing results today. Since the last time that I was at this podium 2 days ago, there have been 30 additional test results that have been received. Out of those 30 test results, only one was positive for COVID-19, and the other 29 of the results received were negative. It is important to note that out of the 51 tests that have been conducted locally, only one person thus far has tested positive for COVID-19. The one positive result or additional positive result that I'm reporting today is an imported case. The person traveled to Bermuda on March 11th on British Airways flight 2233. For those of you who are on the March 11th flight, your self-monitoring period ends today. If you have not been unwell during this period, there is nothing else to do. If you have respiratory symptoms, such as a cough, even a mild fever, please contact your doctor. Explain that you were on the March 11th flight and you would like medical guidance. Do not go to your doctor's office or the hospital. Please ensure that you call ahead. It is important that COVID-19 testing is timely, accurate, and prioritized. The decision to test is based on both a clinical assessment by a physician and an assessment of the likelihood of infection with COVID-19. The test is most accurate for persons who are symptomatic. As such, the immediate priority is for persons with symptoms and a relevant travel history, or persons with symptoms who are close contacts of a confirmed case. Additional priority are hospitalized patients with respiratory symptoms and symptomatic healthcare workers. All symptomatic persons should immediately self-isolate and contact their physician for an assessment to determine if COVID-19 testing should be done. It is important to remember that it is still flu season, and there are other conditions with similar symptoms of fever and/or cough. Our aim is to test those most at risk and to ensure that we obtain accurate results. Testing of asymptomatic persons could result in false negatives due to premature testing. In other words, testing a person without symptoms and getting a negative result does not rule out the possibility that they have COVID-19 and will become ill over the next few days. Thus, it can lead to a false sense of security. Contact tracing for COVID-19 aims to identify the persons who have had different levels of contact with each person diagnosed with COVID-19. Initial focus is on close contacts. Close contacts are those who have had face-to-face contact within 1 meter for more than 15 minutes or direct physical contact with the confirmed case. Casual contacts, or any contacts that have not had close contact, are also identified. Upon interviewing the person diagnosed with COVID-19, contacts are then advised based on their level of contact and whether or not they are experiencing any symptoms. All contacts should monitor their health and may be required to self-quarantine. It is absolutely vital for persons to comply with public health measures and to practice social distancing to prevent any possible community spread. We must recognize that there is a global shortage of masks, gloves, and other personal protective equipment that is needed to keep our healthcare professionals safe and healthy. You do not need a surgical face mask if you are healthy. You only need to wear a mask if you are taking care of a person with suspected COVID-19 infection. You may wear a mask if you are coughing or sneezing. Masks are effective only when used in combination with frequent hand cleaning with warm water and soap or an alcohol-based hand sanitizer. If you wear a mask, then you must know how to use it and to dispose of it properly. And if you are isolated and caring for someone at home with mild, confirmed, or probable COVID-19, then seek your doctor's advice for wearing personal protective equipment. Under the direction of the Minister of Public Works, the government is working with third sector organizations to provide support to Bermuda's most vulnerable. Many volunteer organizations have long-standing community outreach programs aimed at helping different vulnerable segments of Bermuda. These organizations rely on monetary donations, the time of volunteer and in-kind donations to provide these much-needed services, which include preparing meals, providing housing and shelter for the homeless, counseling, providing accommodation and places of safety for victims of physical and sexual assault, counseling for mental health, drug use addiction services, and the distribution of medicine. With the onset of this global pandemic, all of the existing community outreach programs have been impacted. Our first step was to identify the impact and determine what is required to maintain the level of community outreach that has come to be expected from already vulnerable persons. To complete this small, knowledgeable group of volunteers are coordinating with all of the volunteer agencies and religious organizations on the island. At present, we know that the following is being provided to the various vulnerable groups. 3,320 prepared meals are being delivered each week by 10 different community organizations. 44 persons being housed each night by 2 organizations. 665 mental health counseling sessions per month by 7 organizations, and 2 organizations providing drug use and addiction counseling services. 1 organization providing safety advice to victims of domestic violence and sexual abuse, and 5 organizations distributing medicine to 1,175 people. Once these community outreach programs have been stabilized, The next step is to understand what it will take to amplify these services by each of the voluntary organizations. The Ministry of Public Works will join this effort by providing personnel and transport resources to deliver these services in an efficient, timely, and safe manner. And I would like to recognize the work of all of our community organizations and recognize with Myra Virgil, who is here from the Bermuda Community Foundation, who has been instrumental in assisting with these particular efforts. Thank you. On to the EMO and national security. As I have said and will continue to say, the self-quarantine measures that have been put in place are to protect everyone in Bermuda. Therefore, if you have been told to self-quarantine, then you must do it. The newly implemented community advisory points resulted in delays yesterday. But as I indicated, we believe that this situation can be greatly reduced if people who have no real reason to be on the roads would simply remain at home. The Royal Bermuda Regiment and the Bermuda Police Service will continue to carry out checks at community advisory points. We believe that these checks are having the desired effect in keeping persons at home. I will close with the issue of communications. The Department of Communications continues to look for ways to get information about COVID-19 to the public. Starting today for 2 hours each day between the hours of 12 and 1 p.m. and 5 and 6 p.m., Monday to Friday, there will be live content on the emergency broadcast station, 100.1. The government television station, CITV, currently covers all press conferences live and provides COVID-19 updates 6 times a day for 1 hour. All government press conferences are broadcast on the various cable providers' local channels, and you can also watch the press conferences live on CITV, Facebook, YouTube, and/or gov.bm. The communications team is working to make sure that every demographic in Bermuda has access to the information provided by government. Before I close to take your questions, yesterday I had mentioned the issue of employers that are requiring their staff to work at their offices when they have the capability to work from home. I advise persons that I will be asking the Attorney General to come up with additional regulations which will compel employers to allow their employees to work from home if there is no reason for them to be in their offices. Those regulations have not yet been completed, so I'll be giving a further update on those particular matters tomorrow. However, I will urge all employers, before the government takes the heavy-handed approach, if your staff can work from home, let them work from home. This is not a time to joke. This is not a time to play. We have seen many of our fellow overseas territories have had to enact stricter controls due to the fact that their corporate communities were not cooperating. Before this press conference, I spoke to the Premier of the Cayman Islands and also the Premier of the Turks and Caicos Islands, who have stated that because their corporate partners were not acting in the way that they should, that they have had to take stricter measures. I sincerely do not expect or desire to take those stricter measures here. But if we do not have the cooperation of all of those persons in Bermuda, then we will have an issue. The international business sector has certainly taken the lead, and I would expect the local business sector to follow. So for those of you employers who are requiring your staff who are non-essential to come into the offices, I strongly suggest that you send communication to them today to make sure that they're able to work from home. We all must do our part, and the government does not want to do anything that it does not have to do, but we will take action to make sure that we can contain the spread of this virus so it does not overwhelm our population as it has many countries around the world. With that, I'm happy to take your questions.
I want to ask, being just talking on employers, there's one of our large hardware stores that is requiring or sending memos out to the staff to take vacation. What might you say to that type of behavior?
What I would say to that type of behavior is it's probably not something that will be allowed and accepted, but it's part of the work of which we are going through to make sure that we can put out accurate guidelines to employers. But I would not say that this would be the time for persons to, or employers, to require their person to take paid vacation pay when we are doing something which is in the interest of the entire community. All of us are going to have to sacrifice during this period, but I believe that it's important that we put people's lives and health over profits.
I haven't heard you state anything of the sort of the behavior that's been gang activity in your press conference tonight, your briefing, an upsurge in gun violence. I don't know if this is for yourself or Minister Caines. With the courts being closed, persons being arrested, what happens to the process, due process for these individuals might be held in custody? Are they going to be charged? What's your process?
I'm happy to defer to the Minister of National Security. Minister?
Can you repeat the question, please?
If an individual being arrested last night, 72 hours is the law for this individual to be in custody. If he has to be charged and the courts are closed, what is the process moving forward?
As you may or may not know, the Firearms Act gives special provisions if an application is made in the Supreme Court for a person to be held in custody for up to 14 days. If a judge in the Supreme Court deems fit and the proper affidavits are filed, a person where they have not been officially charged can be held for up to 14 days in custody at one of Her Majesty's facilities.
As you're briefing today, as we talked last night, are you overly concerned about the upsurge in this type of behavior? Activity, I should say.
Trevor, last night, as you know, I had the opportunity to be in the Parsons Road area, and I can say that I was deeply concerned. This happened in a house with a number of children that were home at the time. The people in the neighborhood have, over the last few months, seen a number of instances of gang violence in their neighborhood. We, as right-thinking people in Bermuda, should abhor this type of behavior. The men that are doing this activity must be held to account. We are dealing with a very significant set of circumstances with reference to COVID-19. Our country does not have the belly or the stomach to deal with antisocial behavior of this magnitude. I can report that a significant arrest was made shortly after the shooting last night. The Bermuda Police Service obviously were out and they were able to deal with this matter and make an arrest that we believe is significant. And obviously that person will be going through the judicial process.
Premier, any thought of a curfew to get a hold of this behavior?
Not at this time.
Okay, that's it.
Afternoon, Premier. 30 additional test results. One came back positive today. You had said previously that the 6 confirmed cases before, none of those persons had required hospitalization. What can you say about the 7th case?
Yes. That individual also has not required hospitalization to my knowledge. I think that is the hope, that we can identify individuals in the community and allow them to be cared for appropriately in their homes and not have any impact on the hospital system, which is, as you know, quite limited and stretched in its capacity.
Premier, for yourself or whoever's more appropriate. In the release that came out last night, you said that 30 samples had been collected on Tuesday, 1 test done on Monday. How many tests were performed today?
Today was an off day for logistical reasons. The testing is now scheduled for Tuesdays, Thursdays, Saturdays, and Sundays. And there are processing and operational issues around the testing. It's important to make sure that individuals who are identified as needing testing are able to attend for the testing, because what we found is when we scheduled for same-day testing, there were spots that were not taken up. So it's really a practical consideration, and we're hopeful that Tuesday, Thursday, Saturday, and Sunday will work. And again, testing is only for individuals referred by their physician who've been identified as requiring it.
Sure. Can we get an update on how many test kits are currently available for use in Bermuda?
That number is not available to me right this moment, but it's somewhere less than 100 at the moment, and we're expecting a shipment of quite a few more. Test kits require reagents and also require swabs, so there are lots of pieces of medical equipment and items that need to be factored in when you look at what is the capacity for testing. So it's not a quick question if you wanted to know how many people can we test at the moment. We're anticipating that tomorrow, Thursday, there would be on the order of 30 or 40 tests done at that time, and that is an operational matter with regard to how readily we can have individuals come into the testing site and leave with some level of privacy, and also not rushing the staff in processing.
If I can ask you to just go a little further on that, the next batch of tests, do we know how many is scheduled to arrive and when specifically they are scheduled to arrive?
No.
Can I just add?
Yes.
Thanks, Dr. Abel. Yeah, good afternoon. I've actually been in contact with Helix Lab, which is the lab, as you can appreciate, that we've spoken about previously, that is performing the PCR real-time testing here in Bermuda. And they've indicated that in addition to them sourcing further supplies with Public Health England, who are assisting all of the overseas territories, there is another lab that they've been in contact with in America who has indicated they've provided us with the lot number, so we're anticipating those to be shipped in due course. And there's yet a third stream that is being explored that we have made orders, that the lab has made a request and order from. So we're examining a number of options. We are anticipating receiving more hopefully by next week. But again, we've got Public Health England assisting with respect to that, as well as 2 other private labs in the United States to help us to acquire the necessary facilities that we require to continue the testing.
Premier, okay to go a little bit.
Good evening.
No, hold on.
Sorry, Gary.
On the phone.
Sorry.
Premier, on Tuesday night, you mentioned that there was work still underway to provide a Delta flight to replace the one that I guess had been scrapped on Sunday. Is there an update you can provide on that?
Very little update that I can provide this time. The information that has come to me is that Delta will not be putting back on a flight. That's what's come. There's still further negotiations and discussions. There's email traffic up to about 15 minutes ago, figuring out what exactly is going to take place there. We'll look to try to get an update out to the public tomorrow morning on that. We do need to reach back to the U.S. Consul General. We should remember that this was a request by the U.S. Consul General for repatriation of citizens from the United States, back to the United States. So this was a matter that they were particularly handling, but we're trying to close that particular circle, as we recognize that there were some persons who wanted to come home who were unable to do so due to that particular flight being canceled on that day.
In the update yesterday, you talked about, and you touched on it tonight again, possible penalties for employers who don't allow workers to work from home. Is there any more you can provide on that now, or is that something best left for tomorrow? You said there's an update on that.
Certainly. I don't want to get ahead of the legal items on that particularly, but I can just state on a very plain and simple matter. Given the amount of companies, whether it's our hospitality sector, whether it's our restaurant sector, whether it's our personal services and care sector, that have had to go through an incredible period of sacrifice at this moment, it is absolutely unconscionable to think that large local companies who have the capacity and the capability for their workers to work from home will require them to come into the office. That just doesn't make sense. If your staff can work from home, let them. I should not be getting complaints into my email box from employees saying that I can work from home, but my office will not let me work from home. And I'm not going to start naming and shaming people, but these companies know they are. And they are large local employers. Let your people work from home. I don't want to come down with the hammer of the law, but I'm happy to do so. It is simple. We are in an emergency situation. The Minister of Health has declared that this is a public health emergency. This is a global pandemic which is taking place. And the fact that they'll have employers that are still telling their staff, after there are community advisory points to the road, we have the regiment, we have the police, we have everyone else talking about non-essential services. The thought that people would be requiring persons who are non-essential to report to work is unfathomable. So those employers know who they are. And if you are in the public, and if you have an employer who is doing that, you are welcome to email me directly at premier@gov.bm. I will happily keep your information anonymous, but I will make sure that your employer is followed up on, because that is not what we are supposed to be doing during this point in time. And I promised yesterday we'll have an anonymous reporting form, and that form will be announced tomorrow. But I just cannot express it enough. Let your employees work from home.
my final question for you, and thank you to everybody for being patient with me. Bermudians on cruise ships, I know that we had spoken before about there being a number of people who are still stranded. What update can you provide on that situation?
Do you have the latest figures? Or do you want me to handle it? Off the top of my head, I don't actually believe that there's any real significant change. I think it's about 30 Bermudians overseas in total on cruise ships, some that are in the southern hemisphere, some that are coming back. A lot of these cruise ships have been denied boarding. I think there was a South American cruise where they were denied boarding in Brazil, or disembarking in Brazil, so they're heading back up to Florida. So these are all parts of the factors in which we're trying to assess regarding any return flights which we may ask to be offered by any of the airlines in consultation with the U.S. Consul General going forward. And I do know as well that there is a number of Bermudians, I think, that are in Cape Town, in South Africa on a cruise. I don't know if it's Cape Town specifically. I think that number is about 6. I know that we are continuing to work through Government House on these with the United Kingdom's overseas missions. You've asked about this question twice, Paul, and what I will ensure to do is that the next time that I'm standing here at this lectern that I'll have the full readout in front of me, so I'm not having to pull from my memory, so I can give you the full update. But I do recall reading an email on that earlier today. I do know that some of the passengers that were on that South American voyage were denied the ability to disembark in Brazil. So I think they're heading back to Florida at this point in time.
Thank you very much.
Thank you.
Okay, Don?
Yes, we talked about having the test done every other day. I know there was a gentleman today, he went to the hospital, but he tried to get a test done and he couldn't, and then he ended up collapsing and was taken to the hospital, and he's now in the isolation ward. The initial test came back for pneumonia, but they also tested him for COVID after he was there. Are we putting our citizens at danger?
Have the conversation with their healthcare provider with regard to the symptoms that they're having, the possible risk factors that they may have had, and it's a clinical decision, but it is also a public health decision. It looks at the risk that someone might have been exposed to an individual who is a COVID-19 positive case. And that takes a lot of intuition as well as some level of scientific consideration. You have to look at what the risk factors are, where the person has been, who they've been involved with. So it's very, in a perfect world, we'd have an unlimited supply of tests, an unlimited supply of swabs, and anyone who had respiratory symptoms and had any reason to think that they might have been in contact with someone who had COVID-19 could be tested. Or even in a more perfect world, we'd be testing asymptomatic people, but that is not available now, and the tests that we have are limited, so we do have to prioritize. And I would say that the most important thing for the community to be aware of is that there are lots of reasons that an individual will take ill and need to be seen in an emergency room. COVID-19 is one reason, and it is important to have an assessment and a clinical oversight by a physician to determine who needs to be tested for COVID-19. Individuals can collapse for all manner of reasons, and being in close communication with a primary care physician is very important at this time. And another thing I will say while I have the attention is that individuals are really needing to make sure that they're taking care of their chronic medical conditions, because the last thing that we need is to have individuals with chronic conditions like diabetes or hypertension or kidney disease decompensating at a time when there is also influenza and COVID-19. So the more you can be well, stay at home, the better.
This particular individual had traveled quite a bit prior to the airplane lockdown and had been unwell for 14 days. And the person who's related to him told me they didn't have a fever because they'd been taking Tylenol for some of their conditions, and they figured that the Tylenol was suppressing the fever, the temperature number.
Yes, that can happen. It is important to recognize that there are about 2,500 individuals who at some point have had some level of public health supervision because of travel. So again, the contact with primary care doctors, people who normally would look after you, is very important if you should take ill after having traveled.
Can we get some sort of age band breakdown of the 7 confirmed individuals? Male, female ratio?
That exists for sure, and to the extent that we can maintain people's privacy in this very intimate community, we will start to give some demographic breakdown in the future, certainly as the numbers get larger. But these are all adults.
There was a mention about the mask. How much or how long of a supply of medical masks does the hospital have?
I couldn't answer that question, but I can say that they are using them with great wisdom because of the global situation. There is a global shortage, and so as you would know, elective procedures, for instance, are being deferred just for that reason, to maintain our supply, because we don't know what the future weeks even is going to lead to. So it is best to be cautious. I can't speak to the actual supply that the hospital has.
For each of the confirmed cases, how many tests will they need to take?
For a confirmed test?
Yes. Well,
a confirmed result?
Because they'll have to take one for, they took one obviously to be confirmed, but then they'll have to also take one to see that they're no longer positive? We're
not using that method of deciding when an individual can get back to their usual life. It is 14 days after, if you've been quarantined, if you've had no symptoms, you can go back to being, considering that you're not infected. But once you've had the infection, the metric that we use is 14 days or 3 days after all symptoms have ended, whichever is longer.
Minister Caines, with the...
if I may, just for one thing, because I think that it's important to note. And the premise of your question, of course, Don, I will push back on it strongly about us endangering people's health, and I don't actually appreciate the way in which that was asked. But here, allow me to say this, and I think that it's very important to note. What the Chief Medical Officer said was testing collection. There's a difference between testing collection and the running of tests. So there's public health testing collection of where they run. The hospital's testing is prioritized. So if the hospital needs a test, it's not to say that those tests are only going to run every other day. And I think that's an important distinction to make. It's the collection points of where we're doing public and community collection, which is being done on an every other day basis right now, which was being done previously to manage the flow. So I think it's important to recognize that particular distinction.
Okay, it's just the way that it was.
I understand, and that's why I'm clarifying it for you as well. Okay. The hospital has priority, and if the hospital, these tests are extracted to the hospital, and if the hospital needs something done, I'm certain that they work out the way to make sure that happens. But we're talking about community testing that's happening, and the collection, which happens at a single point in time at the Hamilton Clinic.
All right, thank you. While you're there, the people that were on the private jet, what day did they come in?
That information was given previously in previous press conferences. March 8th.
March 8th, okay.
Yes, thank you.
Minister Caines, on the checkpoints, how many people have been identified as being out when they should have been home?
Do not have that information available at present.
But there have been some people?
I do not have that information available at this moment.
Okay.
All right. Joe, you have another question?
I was going to ask, how many numbers are the numbers, those that are quarantined or self-isolation? Is it 800? Can you confirm or deny? Or has the numbers gone up or come down?
I would say the numbers are changing every day. The numbers, however, are updated on the website all the time. The numbers that we have in front of us right now: self-quarantine with active monitoring, 34; self-quarantine with public health supervision, 1,464; self-monitoring with public health supervision, 898. And those are updated on the website on a daily basis. So as the periods end, of course, the mandatory self-quarantine period commence on, I want to say, mandatory self-quarantine period commenced on the 17th. So those numbers will not begin to go down until the 31st.
My last question, for the garbage disposal that's on the side of the roads, how is the process going with that, Colonel? Are we making headway? Especially
of course we're making headway. We're virtually back to normal. I've been very encouraged by individual truckers in the country who have volunteered to go in their neighborhoods and pick up trash, led by C27, of course. And I can report that we are virtually back to normal.
We have Bermuda Broadcasting on the phone. Go ahead, Gary.
Thank you. Good evening, Mr. Premier. I just wanted to ask, in the US, New Jersey is seeing a sharp rise in coronavirus cases. Their neighbours in New York are seeing cases double every 3 days, according to Governor Andrew Cuomo. We have 2 container ships and a cargo plane bringing supplies to Bermuda from New Jersey. Firstly, how do you ensure that the crews which run these container ships and cargo planes don't inadvertently transmit the virus locally when in Bermuda?
I'm happy to answer that question because these are things that have come before the Emergency Measures Organization, and these are things that have been under consideration for some time, as long as 3 weeks ago. And so there's procedures that have been put in place at all the ports to ensure that there is no transfer of issues when it comes to crews, and making sure that the social distancing on those particular levels are maintained. So on that particular level, that is something that was, I would say, identified as a risk early, and those issues have been being dealt with under a risk to have that risk properly managed for the last 3 weeks. In addition, on the stevedores, they're working split shifts to ensure that there's not cross-contamination from shifts in the case that there happened to be one person that either had local transmission or from somewhere else. But it's important to note, as the Chief Medical Officer stated before, that out of the 7 cases, that none of the cases that we've had positive thus far have required hospitalization. There are some cases that have fully recovered, and I think that it's important for us to note that we are doing a very aggressive testing, with 38 tests collected yesterday, which will be run through the system. So we're doing a significant amount of testing on island, and this is something that is important to note.
Any further questions from the phone?
I do have a further question. Just following that up, with the coronavirus outbreak over in the US, does Bermuda have a backup plan to ensure supplies of food and medicines continue to arrive if people on the East Coast supply chain can no longer work because of the coronavirus?
That question has been asked on numerous occasions before, Gary. I will answer it again, that this is something that we did not just start planning for yesterday. It is something that we've been planning for since January 31st, when the World Health Organization declared this a public health emergency of international concern. When those things happen, we step up our preparations. There are contingency plans in place for food and supply importations to continue.
Okay. Are you able to share any of those contingency plans?
I don't know
where those would come from.
I'm not particularly certain of which you're asking for, but the first instance is our ships come out of the northeast. If there are not issues in coming out of the northeast, they can come out of the southeast. They can come out of many different places in the United States. As well, we can also ship to go to the Caribbean and other ACEs. So, I mean, this is what you have to understand. Stevedoring services that are importers do work on this. They have a large number of contingency plans that are in place. The government of Bermuda is comfortable that with the plans of which have been laid out, that we do not foresee any possible disruption to our food supplies and essential services at this point in time.
The one more case that we have, how do we, as a community, guard against complacency in this issue?
Well, I can assure you, Gary, that the government is not complacent in any way, shape, or form. The fact is that it is my expectation that given the amounts of persons that were coming from the United Kingdom and other places, we will likely have more cases. This is the reason why we have been very aggressive in ensuring that self-quarantine is strictly adhered to. We have been incredibly aggressive in getting up our local testing regime so we can ensure to understand what exists here. As the World Health Organization has said, the way in which you deal with this is to test, to make sure that you can break the chains of transmission, to isolate and contain. In a period in time where we are not having any more important cases, it is up for us to ensure that we stop any possible additional local transmission. The Department of Health under the direction of the Chief Medical Officer, is doing an outstanding job in making sure they're following up these particular things in very difficult circumstances, as there are a lot of persons who are understandably worried about what is happening around the world. But what is important for us is for nobody in Bermuda to be complacent. And that is the reason why we are being so strong on our advice, and we are going to repeat the strength of that particular advice. It does not make sense to be complacent. We have to make sure at every single point in time we are washing our hands, maintaining our social distance, keeping our hygiene, and reducing the possibility for there to be any type of local transmission of this virus, so that we can make sure we beat it and do our best to maintain a sense of normalcy as quickly as possible. But as I said in my initial statement, I don't know when this will end. But what I can say is that this will go on longer if we do not, all of us, act responsibly. And I want to give, again, a special shout out to all of the people in the community who are working incredibly hard to fill the slack. And a special thanks, of course, Colonel Burt had noted the private truckers who have come to the aid during this particular circumstance. I'd also like to recognize the members of the Corporation of Hamilton staff, refuse collection staff, who have also assisted during this point in time.
Any further questions, Gary?
The last question is transportation for our hospital workers. Obviously, when it comes to public transportation, etc., is there a special bus being provided, and when will it be up and running, if there is?
We just received the confirmation this evening that there is a plan for that. We will share that at the first instance with the CEO of the Bermuda Hospitals Board. What it looks like is special locations that will be set out for the hospital staff, and that information came in just before we arrived this afternoon. I would like the opportunity to share that with the CEO of the Hospitals Board before we give it to the members of the public.
Thank you.
One last question. A question just came over as I'm watching here. Are we having any measures, price control for food supply? Because prices seem to be going through the roof in some of these shops.
What I will say is that we have the ability, and this question has been asked me before, and I will repeat the same answer again, that we have the ability to inquire under the Cost of Living Commission Act. The chairman of the Cost of Living Commission is the Deputy Speaker of the House, Derek Burgess, who has the power of inquiry. The Minister of Home Affairs, the Deputy Premier, has previously put out a release regarding any cases of this can be investigated and prosecuted. And I would strongly urge that if any particular person has any of those particular cases, to make sure they report it to the Ministry of Home Affairs, and I'll make sure that there is additional information that goes out in the future, given that there's no one in that particular office, to make sure that we get a special email set up. But the fact is very simple, and retailers should be on notice, that there are powers of inquiry underneath existing laws, and if you are inquired into and found to be doing things that's in contravention to the existing laws in Bermuda, you can be prosecuted for that, and we will not hesitate to do so.